Welcome to today's educational journey as we delve into the world of cryptococcosis, a potentially serious fungal infection that often affects the lungs. We'll explore its causes, how it develops, who's most at risk, and what can be done to treat and prevent this condition. Let's begin. Cryptococcosis is primarily caused by two species of fungus, Cryptococcus neoformans and Cryptococcus gattii. Cryptococcus neoformans is commonly found in soil contaminated with bird droppings, particularly those of pigeons. Cryptococcus gattii, on the other hand, is often associated with certain tree species in tropical and subtropical regions. Infection occurs when a person inhales the fungal spores, making the lungs the primary entry point. Once inhaled, Cryptococcus spores can travel deep into the lungs. In individuals with healthy immune systems, the body's defenses may effectively contain the infection, preventing it from spreading further. However, in people with weakened immune systems, such as those with HIV/AIDS, organ transplant recipients, or those taking immunosuppressant medications, the fungus can multiply and disseminate from the lungs to other parts of the body, most notably the brain and meninges, causing meningoencephalitis. The fungus's capsule, a polysaccharide layer surrounding the fungal cell, plays a key role in its virulence, protecting it from phagocytosis and facilitating its spread. Cryptococcosis has a worldwide distribution, but its prevalence varies depending on geographical location and the population's immune status. Cryptococcus neoformans is more common in urban areas and is the primary cause of cryptococcosis in immunocompromised individuals. Cryptococcus gattii is more prevalent in certain regions, like the Pacific Northwest of North America and parts of Australia, and can cause infection even in people with normal immune function, although it's still more dangerous for immunocompromised people. The symptoms of pulmonary cryptococcosis can vary depending on the severity of the infection and the individual's immune status. Some people may experience no symptoms at all, while others may develop a cough, chest pain, shortness of breath, and fever. In cases where the infection spreads beyond the lungs, symptoms can include headache, stiff neck, confusion, seizures, and vision changes, indicating cryptococcal meningitis. Diagnosing pulmonary cryptococcosis typically involves a combination of imaging studies and laboratory tests. A X-ray or CT scan can reveal lung nodules or infiltrates. Sputum samples, bronchoalveolar lavage fluid, or lung biopsies can be examined under a microscope and cultured to identify the presence of Cryptococcus fungi. Blood and cerebrospinal fluid may also be tested, particularly if dissemination is suspected. Specific tests, such as the cryptococcal antigen test, can detect the presence of fungal antigens in bodily fluids, providing rapid and accurate diagnosis. While we don't generally categorize cryptococcosis into distinct subtypes the same way we might with, say, pneumonia, the clinical presentation and disease severity can vary significantly. We can broadly classify the infection based on its location. Pulmonary cryptococcosis refers to lung involvement only. Disseminated cryptococcosis means the infection has spread beyond the lungs to other organs, most commonly the brain, meningoencephalitis. Understanding the extent of the infection is critical for guiding treatment strategies. Treatment for pulmonary cryptococcosis depends on the severity of the infection and the patient's immune status. For mild to moderate infections in immunocompetent individuals, oral antifungal medications, such as fluconazole, may be sufficient. More severe infections, or those in immunocompromised individuals, often require intravenous antifungal therapy with amphotericin B, often in combination with flucytosine. After the initial induction phase, patients typically transition to a consolidation and maintenance phase with oral fluconazole to prevent relapse. Regular monitoring is essential to assess treatment response and manage potential side effects of the antifungal medications. Preventing cryptococcosis, particularly in high-risk individuals, involves minimizing exposure to fungal spores and optimizing immune function. While complete avoidance is impossible, steps such as avoiding areas heavily contaminated with bird droppings can help. For individuals with HIV/AIDS, early diagnosis and consistent adherence to antiretroviral therapy are crucial for maintaining a strong immune system and reducing the risk of opportunistic infections like cryptococcosis. Prophylactic antifungal therapy may be considered in certain high-risk populations, but the decision should be made on a case-by-case basis by a healthcare professional. The prognosis for pulmonary cryptococcosis varies greatly depending on the individual's immune status and the extent of the infection. With prompt and appropriate treatment, many individuals with localized lung infections make a full recovery. However, disseminated cryptococcosis, particularly cryptococcal meningitis, can be life-threatening, especially in immunocompromised individuals. Recent research has focused on developing new and more effective antifungal medications, improving diagnostic techniques, and understanding the mechanisms of fungal virulence and host immunity. Advances in these areas offer hope for better outcomes and reduced mortality associated with this challenging infection. Continued research and awareness are crucial in the fight against cryptococcosis.